Welcome to our channel. If you need a bilingual doctor or medical interpreter, follow these step-by-step instructions to access healthcare in your preferred language. Step 1. Contact your insurance company and ask for a list of bilingual providers in their network. Many insurers track which languages their doctors speak and can provide targeted referrals. Step 2. Use online doctor search tools that allow filtering by language. Websites like HealthGrades, ZocDoc, and your insurance company's portal often include language capabilities and provider profiles. Step 3. Call medical practices directly and ask if any doctors or staff members speak your language. Front desk staff can tell you about providers' language skills and bilingual team members. Step 4. Contact local community health centers. These facilities often serve diverse populations and employ multilingual staff or have interpretation services readily available. Step 5. Request a professional medical interpreter if a bilingual doctor isn't available. Under federal law, healthcare facilities receiving federal funding must provide free interpretation services to patients with limited English proficiency. Step 6. Ask about telephone or video interpretation services. Many hospitals and clinics use on-demand interpretation systems that connect you with professional interpreters in minutes. Step 7. Verify the interpreter's qualifications. Medical interpreters should be trained and certified to ensure accurate communication of complex medical information. Step 8. Bring a trusted bilingual family member or friend to appointments as an additional support. However, always use professional interpreters for important medical decisions and complex information. Don't forget to like this video and subscribe to our channel.